All right, well, good afternoon, Chair and Member. I'm pleased to present AB 2531 today. In December of last year, the Trump administration finalized a rule to prohibit the Veterans Health Administration, known as the VA, from providing abortion care. The potential effects of this decision are profound. Veterans in California, those who have worn the uniform and put their lives on the line, are now being denied basic reproductive health care from the VA because of the Trump administration's discriminatory policies toward women. Throughout my tenure in the legislature, I have always maintained a steadfast commitment to our veterans. Whether it was through my time as chair of the Military and Veteran Affairs Committee or through the legislation I ran to place Prop 1 on the 2024 ballot, it has always been a priority of mine to ensure that we take care of the people who served our country. And taking care of veterans is exactly what this bill does. AB 2531 puts our veterans first where the federal government has failed them. It narrowly expands access to our existing uncompensated care grant program, so it will include veterans whose federal health care coverage does not include abortion services. This will ensure that veterans who cannot receive abortion care or abortion counseling through the VA health system are not left behind. The bill also requires that the California Department of Veteran Affairs include a link, abortion.ca.gov, to their existing list of resources for veterans to ensure that our veterans know they have access to this critical health care coverage. With me to testify in support of the bill today is Angela Pontes on behalf of the bill sponsors, Planned Parenthood Affiliates of California.
Thank you, Madam Chair and members. Angela Pontes on behalf of Planned Parenthood Affiliates of California, representing the 7 Planned Parenthood affiliates across the state, serving patients from every county. We'd like to thank the author for introducing this bill. We are a proud sponsor. As explained, AB 2531 responds to recent federal action that severely restricted access to abortion care through the Veterans Affairs system. Under this new policy, the VA can only provide abortion in life-threatening circumstances, which we know is an intentionally ambiguous threshold that has dangerous and cruel consequences. Despite California's constitutional protections for reproductive freedom, our state's veterans and VA providers cannot obtain or provide abortion care. To address this inequity, AB 2531 would narrowly expand eligibility in the existing uncompensated care grant program to include veterans. With this bill, veterans may only access abortion care by paying out of pocket at a non-VA provider. Planned Parenthood Health Centers are proud to be amongst the providers in the uncompensated care grant program offering abortion and contraception. We ask for your aye vote.
Thank you so much. Those in the room who are in support, if you want to come up for your Me Too's.
Thank you. Craig Pulser on behalf of Equality California in support.
Martin Radosevich on behalf of Reproductive Freedom for All California in support.
Thank you. And any principal opposition? Go ahead and start when you're ready.
Chair and members, my name is Leandra Wells with the California Family Council. I'm here today to respectfully oppose AB 2531, a bill that uses taxpayer dollars to promote abortion services to veterans without providing the full scope of support our veterans deserve. Our veterans have already given so much in service to this country. The question before us is simple. Are we truly honoring them, or are we offering them a narrow, incomplete answer in a moment of vulnerability? State health websites carry authority. When the government speaks on medical care, people responsibly expect balanced, comprehensive, accurate, and free from bias information. But AB 2531 risks failing that standard if it promotes abortion without equally presenting alternatives like adoption services, pregnancy resources, and safe surrender options, and community-based support programs. Women deserve full support, not filtered information. They deserve to know every pathway forward, not just one. Because when women are given real support, real resources, and real options, they are more likely to give their baby a chance at life. And we cannot ignore the broader context. Veterans already face some of the highest rates of PTSD, depression, and suicide risks in our nation. According to the U.S. Department of Veterans Affairs, that reality demands caution, care, and responsibility in how we present sensitive medical information. We must also acknowledge the research indicating mental health correlations associated with abortion, including findings by Dr. Priscilla Coleman reporting increased risk of depression, anxiety, and suicidal behaviors among some of women following abortions when they have an abortion. AB 2531 does not expand choice, it narrows it, and it does not strengthen veterans. It risks failing them at a critical moment. And so for these reasons, I respectfully urge a no vote for AB 2531. Thank you.
Thank you. Any other opposition in the room? Name and organization? Okay, seeing none, bringing it back to the dais for any questions? Vice Chair.
Thank you, Madam Chair. I just got need some clarification on some of the words that are used in here. As a veteran, I'm just trying to put it through that lens, okay? When you talk about patients who self-identify, what does that mean?
Well, for the uncompensated care program, they already have to self-attest that they have for their income level. So it would be this, there's no structure in place to self-attest that you're a veteran. We could ask for the veteran medical cards, but we think that that would be extra burden. But they're already self-attesting to their income level to qualify for this fund.
So I just want to kind of focus on the self-identify as a veteran, that specific piece. Every 100% of veterans, 100% of them, leave with a DD-214, every single one of them. And if they cannot, let's say they lose it, they can go get it from their VSO, and the VSO can help them. It's not a hard process. So my problem with the wording is self-identify to me, and please correct me if I'm wrong, is I'm John Smith, and I show up and I say I'm a veteran. There's nothing to prove in that self-identify that I'm a veteran. So the gap in that is the fact that we're saying that people could say that they're veterans and they possibly couldn't be veterans, right? And we take that very seriously in the veteran community. By people, I'm not saying that everyone's gonna do it, but it leaves a gap. So that self-identify word, I think there's room to fix that in saying a identified veteran with a DD-214, that covers 100% of everybody. What are your thoughts on that?
Well, again, somebody who is trying to, I completely agree. Nobody should be identifying as a veteran if they are not. So I do want to give you that. But if somebody is trying to use these financial services, they can already attest that they are low income. So they would still be able to get the services. They don't necessarily have to prove that they are low income. They can attest that they meet the limits that are required to be eligible for the fund.
So if they're attesting that they are low income, right, then they have access to abortion services, correct?
Correct.
Here in California. There's nothing stopping that. I'm trying to get a line here.
Yeah, in this program, if they don't otherwise qualify for coverage through employer coverage or Medi-Cal or one of the eligibility programs in Medicaid, in Medi-Cal programs, then this is a backstop program to access abortion for the uninsured. So this is a narrow.
I'm just confused. Again, I got to kind of paint it very, if you will, basic for me. Sally Smith shows up and she says, I need an abortion. Does she have access to an abortion and it's paid for?
If she attests that she is
not under this, just right now in California, can she get an abortion?
Depending on her coverage, if she has coverage, yes. But this program addresses the gap for the uninsured, and in this circumstance, proposing to narrowly expand for, like, if your coverage doesn't include abortion, which is what this is addressing.
So are you saying that uninsured Californians cannot get abortions?
Sorry, I'm trying to answer your question. If you are uninsured and you cannot pay for an abortion, the uncompensated care program was created to cover the costs of that care.
Which, that uncompensated care program is currently in place, correct?
Yes.
Okay. So if Sally Smith goes in and says, I fit under this, whatever the requirements are, can she get an abortion? Yes, if she has the coverage, number one, or yes, she has the coverage, she can get it because of this program, correct? So either way, Sally can get the abortion, right?
Well, we're talking about veterans that probably have VA insurance, and now that VA insurance no longer covers. So there is narrowly, the third option is that that Sally attests to being a veteran.
I'm there. I'm just trying to first put the pieces together so I can understand it better and make an informed decision on it. Right now, anyone can get an abortion in the state of California because that is law. So if it is currently law that anyone can get an abortion, are we saying then this?
Just a correction though. If you can afford it or access some uncompensated care. And the point I think that's being made is that if your care is through the VA and that is no longer providing care for you, then this is an option to cover that abortion care. Correct? Yeah, if you're a veteran, correct. Well, yeah, if you have VA care, you're a veteran.
Right, that's why I'm confused, because right now we're saying that anyone can walk in and get an abortion because it's covered no matter what.
The program was created for those who cannot cover the costs. It's intended for low-income individuals and those that don't have insurance and otherwise means to pay. So there is an income threshold in the current program.
In this current program or the current program that
The
is already existing?
The existing program,
There's an income cap.
yes.
Okay.
So
got
the
it.
veterans.
That's where I'm trying to kind of understand. There is a cap. So we're talking about anyone above the income threshold
That has
also
insurance.
a veteran. Gotcha. Okay. We've arrived. Okay. Sorry. I want to make sure I understand what you're getting at, because obviously you can see my confusion in that if it's already there, then why are we creating another program that's already in place? But you're saying this is above and beyond the cap. Okay. If it's above, so the first point was DD 214. I'm vehemently opposed to anyone that self-identifies, because there is a mechanism currently in place right now in all counties. Every single, we have VSOs right here representing VSOs in every single county where they can just go and it's easy. We do that for homeless folks. We do that for all kinds of people. They do an amazing job. So the self-identify piece, I think well, I know for me, it creates a problem. So I can only imagine other veterans, it would create a very, very big problem. So I'd love to, if that's a way to correct that, that would be ideal. The second piece of this this puzzle is I'm sorry, how much is there an allocation for this, a budget request, or there is, and what is that?
So this program was created in 2022 following the Dobbs decision with $40 million in funding. The program is currently funded in its final round of funding. So we're working through the budget process this year to request additional funding to continue the program.
The Dobbs program?
The uncompensated care program.
The uncompensated program. And this would fall under the uncompensated program?
Yes.
So this is addition, this is not a separate program unto itself?
This is the uncompensated care program, yeah.
All right, then we have to go backwards again, because earlier you said the uncompensated program is already in effect, right? expanding access. Gotcha. Okay. With this expansion of access, you're already asking for dollars associated with this.
It's a separate
What
budget
is that
ask.
ask?
That's a separate budget ask. That's not part of this bill.
Okay. What is that?
The request is for an additional $30 million to continue the program for 3 more years.
Okay. I know that my colleague has some things to say. The VSO program is in dire straits and could use $14 million on a regular basis. So to me, the primary focus when we're talking about our veterans and the care and the resources that they need, I look back to the VSOs and I say, what about their $14 million? What about their ability to help those who need other resources? And it's because of that and the additional pieces to this that I will be voting no.
Councilmember Davies.
Thank you, Madam Chair. A lot of it was more clarified, but with me again, I really have a concern with the self-identified as a veteran, because there is easy access to getting that DD 214 card. If they don't have it, you can go online. As you said, you can go to the nearest place to have it. So, and the reason why is right now, fraudability is huge. I mean, it's every day we're seeing where there's fraud, and we have to make sure that these are taxpayer dollars. These are taxpayer dollars that would be going to cover this, and that we have to make sure that that isn't an option. And that's really one of my biggest concerns, because I was just reading an article and it said that the amount of veterans, have gone down over the last 4 years. However, the number that are actually getting health care has gone up by 34%. So there's fraud pretty much everywhere. I mean, we can go right down the line. And that's where my concern is. We are here to protect taxpayer dollars and make sure they go where they need to go. But there's a door that's open, very easy for me to just walk in and say, I'm a veteran, and go ahead and take and get that. And especially, I think, honestly, we look at our veterans, they have given their life. They have earned this, they have worked for this. And for someone just to say, I'm a veteran, and go ahead and get the same, it upsets me, because I just think we need to we have to close that hole. We really need to take that off, that word self-identifying, because this is something that isn't just a social thing of I self-identify this. This is something that decision, and that being said, would be taking tax dollars. And it's opening the door for fraud. And every penny should be going to our veterans. And this is a place where I'll guarantee you within a year, you would see fraud.
I will just say we all are very concerned about fraud. If there is a fraudster, they could already access the fund by saying they are low income. So we do not want people to say they're veterans if they're not veterans for any of these services. And let's remember, this is money being requested by Planned Parenthood. This is not money that is going to veterans. This is a fund that is now going to just slightly expand to serve veterans. But I don't see that this opens the door to fraud, because it is already a possibility to utilize that fund if you say you're low income.
So
that would be
you just open up another door that we do have. There's a fraud going there. Can't we just at least not give them another opportunity to have fraud in this position? I know every single person here believes veterans deserve so much more than they're getting.
Absolutely.
And I think it's a disservice to be able to let someone identify themselves as a veteran, especially when our veterans have given their life or their limbs and their families, to be able to just say, yes, I'm a veteran. And so that's where I'm really having the problem with, and I think it could easily be amended by not using that word, that term, self-identify, and just show. I mean, we have to show our card. They have to show that if they're going to get any other treatment, health care, they have to show their card. Isn't that correct, Chair, Vice Chair? So That hasn't been a problem. I can't use that as a reason. I don't think it's a valid reason. And you know, if you could make an amendment with that, I could see that going, but I just can't.
And we will, the main thing we did not want to make is a huge impediment for veterans. So if we are certainly happy to look at something that is very easy to obtain for veterans to prove they're veterans. We had again talked about using the insurance card, the veterans insurance card as identifying, but the numbers we saw were that only half of the veterans actually had the insurance card. So we're happy to look at if there's some easy way to do that. But again, a fraudster can access this fund in other ways.
Well, and I'm glad that you brought that up because I think that's another place in that we need to audit and look for if that's what's happening as well. So
I mean, there's verifications that have to happen and documentation and all that kind of stuff to be able to do that. But I mean, just to clarify, the fraud that you're talking about that could potentially happen in this scenario is so narrow. It is someone who needs, they're not getting money out of this. No one's going and cashing a check out of this. They're getting an abortion. So we're talking about people who need abortion care, getting abortion care that they need. And this is particularly going to, veterans where this has been cut off from them by the VA. The VA has completely cut this off as a service anymore.
Then why don't we, if you have a program like this, why don't you just tell veterans that they're allowed to go to that program and get it covered? Instead of having a program that you're saying that you have to be a veteran to go ahead and have everything covered if you're earning more money.
I don't understand what you're saying.
I feel like we're doing another program that if we could just basically bring the veterans into the same program you have here and just say, you know what, you can be in here, but if your income exceeds this, we're still going to cover it.
That's exactly what it's doing.
But you still have to have proof.
Right, okay, yeah, I understand your point about that. It sounds like the author will look into this further.
See.
Yeah? Okay. I just want to make a couple comments. Thank you for your presentation today and for the discussion. As I just mentioned, the VA has stopped providing abortion care and counseling, even in the instances of rape and incest and health emergencies. These are more restrictive than the Bureau of Prisons policy, which allows for federal funds to be used for abortions under these circumstances. So they're actually treating veterans worse than people who are in prison. And tragically, there are high rates of sexual assault in the military, with 1 in 3 veterans, women veterans, reporting military sexual trauma, or MST. More than 1.3 million outpatient visits took place at the VA for MST-related care in 2017, according to the latest available data. And this ban represents a significant betrayal of the commitment to providing quality health care for those who have bravely served our country. This is deeply hypocritical to celebrate veterans for defending our freedom and then strip them of their bodily freedom, self-determination, and dignity by refusing basic health care. It's a policy that should spark outrage, I would hope, amongst all of us. President Trump promised to leave decisions about abortions to individual states, yet he continues to seek out new ways to impose restrictions on a national level that impact people in our local communities, including veterans. In 2022, California voters decisively passed Prop 1, safeguarding reproductive freedom in our state's constitution. Yet for many veterans relying on federally regulated VA systems, accessing abortion care remains challenging and in almost all cases impossible. So I think that's why this bill is so important. I appreciate you being creative with solutions to ensure that veterans still have access to abortion care when they need it. And with that, would you like to close?
Just when you have a quorum, respectfully ask for your aye vote.
Thank you. We hope we will have a quorum at some point. I see Assemblymember Gibson is here.